Continuity of care. TSI will participate when necessary in transition planning to or from a higher level of service in order to maintain the continuity of care. TSI staff will collaborate with community resources, school personnel, therapists, medical professionals, and any other person that might be appropriate to maintain the continuity of care. All collaborations will be noted in the client record, and treatment plans will be done on an ongoing basis. For management of care, TSI will maintain consistent standards regarding management of care. TSI will implement and maintain written referral forms, assessment reviews, and discharge criteria. TSI shall address underutilization, overutilization, and the effectiveness of available services. Staff will not carry more than 15 cases without permission from the TSI president, vice president, or designee. Discharge planning begins at admissions, determining the patient's continued need for service and plan to address ongoing needs post-treatment service. Now, management of care for substance abuse is the placement screening, continued stay reviews, treatment reviews, and discharge criteria will be followed and documented in the iSmart system. For any client entering Level 1 treatment services, time frame of management of care activities shall be minimally implemented for 30 days. For individuals involved in extended outpatient services, treatment plan and continued stay reviews will be completed at a minimum of every 30 days. It will be documented within the client's individual progress reports, reviews, and are completed. If reviews cannot be completed within the given time frame, it will be documented in the client's file. For individuals involving continuing care services, treatment plans and continued stay reviews will be completed a minimum of every 30 days. It will be documented in the individual's progress notes and reviewed and completed in their file. If reviews cannot be completed in given time frames, it will be documented in the client record. For any client entering a Level 2 1 treatment services, time frame of management for care shall be minimally implemented 7 days. A treatment plan and continued stay reviews, treatment plan reviews, will be completed at a minimum of 7 days. It will be documented within the individual's progress notes when reviews are completed. If reviews cannot be completed within the time frames, it will be documented in the client's chart. Discharge planning shall begin at admissions and determining the client's continued need for treatment services, developing and addressing ongoing patient needs post-treatment. Discharge planning may or may not include the document identified in a discharge plan. Admissions criteria. TSI assures clients meet individual program admissions criteria. TSI staff will follow the manual criteria identified for each program. TSI will comply with state and federal laws regarding program criteria. TSI will follow criteria identified by the payer such as Magellan Insurance or the Department of Human Services. The next section is going to be descriptions of services, purpose, treatment, objectives, outcomes, and service modalities. Our next section is service activities. The policy is TSI will assure that service activities are individualized and focused on the issues and tasks identified in each of the client's treatment plan. The core activities of this is expected to be outcome-based activities, client and family participation, individualized, clinical team participation, discharge planning, and continuity of care. The procedure is TSI's coordinator will develop an outcome-based, individualized, culturally competent treatment plan which has the family, the client, and the clinical team participating. TSI shall begin discharge planning at the time of the client's admissions to the program. TSI staff will maintain collaboration, referral, and communications with outside resources who are participating in TSI services. Next, we have discharge planning. It is the policy of TSI to begin discharge planning at the time of admissions. Discharge planning will include referral plans, linkage to support systems, discussion of planned service activities, and the time frame expected to reach these goals. Procedure. Initial discharge planning will be documented in the initial treatment plan by a program coordinator or the clinician. Continued plan will be provided during the treatment plan review and will be documented in the client record. Discharge plans will include ongoing client needs, referral to, as indicated, post-treatment needs, and client's personal plan for ongoing mental health or addiction needs. Each discharge plan will have a minimal of the to include the following: the final 5-axis diagnosis, a discharge summary including goal achievement, a discharge instructions including techniques that were learned, medications or instructions were used by the prescribing physician, dates of the follow-up appointments, dates, provider, the times documented. Restrictions from work or school would be noted. Now, the discharge planning for substance abuse is the policy of ICP to begin with discharge planning at the time of admissions. Discharge planning will include referral plans, linkage to community sports, and a discussion of the planned level of care within the time frames indicated. Procedures. Initial discharge planning will be documented in the client's record on the admissions portion of the iSmart. Continued planning will be documented in the treatment plans review in the iSmart. Planning will address ongoing patient needs and referrals if needed, post-treatment needs, and client's personal plan on recovery. Thank you.